In which position should a patient with epistaxis be placed? Options are A. Supine with the head tilted backward. B. Sitting upright with the head slightly forward. C. Side lying with the head elevated. D. High Fowler's position with the head tilted back. Answer is B. Sitting upright with the head slightly forward. Sitting upright with the head forward prevents blood from flowing into the throat, reducing the risk of aspiration or swallowing blood. What is the correct location to assess an apical pulse? Options are A. Fifth intercostal space at the right mid-clavicular line. B. Fourth intercostal space at the left mid-clavicular line. C. Fifth intercostal space at the left mid-clavicular line. D. Sixth intercostal space at the mid-axillary line. The answer is C. Fifth intercostal space at the left mid-clavicular line. The apical pulse is located at the apex of the heart, which lies at the fifth intercostal space at the left mid-clavicular line. What position should a patient with a prolapsed umbilical cord be placed? Options are A. High Fowler's position. B. Lithotomy position. C. Knee chest position. D. Supine position. The answer is C. Knee chest position. The knee chest position helps to reduce the pressure on the prolapsed umbilical cord, improving blood flow to the fetus. Which of the following factors can increase respiratory rate? Options are A. Hypothermia. B. Opioid medications. C. Exercise. D. Decreased metabolic rate. Answer is C. Exercise. Exercise increases respiratory rate to meet the body's higher oxygen demands and to remove excess carbon dioxide produced during physical activity. What is the term for a sudden drop in blood pressure upon standing? Options are A. Hypertension. B. Orthostatic hypotension. C. Postural tachycardia. D. Bradycardia. Answer is B. Orthostatic hypotension. Orthostatic hypotension refers to a significant drop in blood pressure when a person transitions from lying down to standing, which can often cause dizziness. In which position should a patient be placed during thoracosynthesis? Options are A. Supine position with arms at the sides. B. Prone position with arms extended. C. Sitting position leaning forward on a bedside table. D. Semi-Fowler's position. Answer is C. Sitting position leaning forward on a bedside table. Sitting and leaning forward expands the intercostal spaces, facilitating needle insertion during thoracosynthesis. Let's see different positioning for a patient for thoracosynthesis. The nurse can assist the patient to one of these three positions and offers comfort and support throughout the procedure. The first position is sitting on the edge of the bed with head and arms on the overhead table. Second is straddling a chair with arms and head resting on the back of the chair. Third one is lying on unaffected side with the bed elevated 30 to 45 degrees. Which artery is commonly used for blood pressure measurement? Options are A. Radial artery. B. Femoral artery. C. Carotid artery. D. Brachial artery. The answer is D. Brachial artery. The brachial artery located in the upper arm is commonly used for non-invasive blood pressure measurement. Which position is most appropriate for a patient with a suspected air embolism? Options are A. Trendelenburg position on the left side. B. Trendelenburg position on the right side. C. High Fowler's position. D. Supine position. Answer is A. Trendelenburg position on the left side. Placing the patient in the left lateral Trendelenburg position traps the air embolism in the right atrium, preventing it from entering the pulmonary circulation, and this position is known as Durant's maneuver. Which part of the brain regulates body temperature? Options are A. Cerebellum. B. Hypothalamus. C. Medulla oblongata. D. Thalamus. The answer is B. Hypothalamus. The hypothalamus is responsible for regulating body temperature by controlling heat production and loss mechanisms. What is the pulse pressure if a patient's blood pressure is 120 or 80 mm of Hg? Options are A 20 mm of Hg, B 30 mm of Hg, C 40 mm of Hg, D 50 mm of Hg. Answer is C 40 mm of Hg. The pulse pressure is calculated by subtracting the diastolic pressure from the systolic blood pressure. In this case, it will be 120 minus 80, that is 40 millimeters of mercury. What is the term for a respiratory rate of fewer than 12 breaths per minute? Options are A tachypnea, B dyspnea, C bradypnea, D apnea. Answer is C bradypnea. Bradypnea refers to a respiratory rate slower than the normal adult range of 12 to 20 breaths per minute. What is the best position for a patient recovering from a mastectomy? Options are A supine position with arms at the sides, B semi-Fowler's position with the affected arm elevated, C prone position with the affected arm extended, D sideline position on the surgical side. Answer is B semi-Fowler's position with the affected arm elevated. Elevating the affected arm reduces lymphedema and promotes drainage in patients recovering from a mastectomy. When using a manual sphygmomanometer, what is the first sound heard during deflation? Options are A systolic pressure, B diastolic pressure, C pulse pressure, D mean arterial pressure. The answer is A systolic pressure. The first sound, Korofko sound, heard during deflation represents the systolic pressure, indicating the force of blood as the heart contracts. What is the appropriate position for a patient undergoing a paracentesis? Options are A supine with the legs elevated, B sitting upright on the edge of the bed, C Trendelenburg position, D semi-Fowler's position. Answer is B sitting upright on the edge of the bed. Sitting upright allows fluid to collect in the lower abdomen, making it easier to access during a paracentesis. What should the nurse do if the blood pressure cuff is too large for the patient? Options are A. Use the same cuff and take multiple readings. B. Use a smaller cuff instead. C. Use the larger cuff but document the size used. D. Obtain a properly fitting cuff. Answer is D. Obtain a properly fitting cuff. Using a properly sized cuff is essential for accurate blood pressure reading. A cuff that is too large may result in an inaccurately low reading. What is the proper technique to assess a patient's respiratory rate? Options are A. Count the number of breaths for 15 seconds and multiply by 4. B. Count the number of breaths for 30 seconds and multiply by 2. C. Observe chest movement for 1 full minute without the patient's knowing. D. Count the number of breaths while the patient is talking. Answer is C. Observe chest movements for 1 full minute without the patient's knowing. Observing the respiratory rate for a full minute provides the most accurate assessment, especially if the rhythm is irregular. Patients may alter their breathing if they are aware. Which of the following is a normal oxygen saturation level measured by pulse oximetry in a healthy adult? Options are A 85% to 90%, B 90 to 94%, C 95 to 100%, D 100 to 105%. The answer is C 95 to 100%. Normal oxygen saturation level in a healthy adult ranges from 95 to 100%, indicating adequate oxygenation of the blood. How should a patient with GERD, gastroesophageal reflux disease, be positioned? Options are A supine position after meals, B semi-Fowler's position after meals, C prone position at bedtime, D high Fowler's position at all times. Answer is B semi-Fowler's position after meals. Semi-Fowler's position reduces the reflux by preventing stomach acid from flowing back into the esophagus. Which abnormal breathing pattern is characterized by cycles of deep, rapid breathing followed by periods of apnea. Options are A. Tachypnea, B. Kussmaul's respiration, C. Chain stroke respirations, D. bradypnea. Answer is C. Chain stroke respiration. Chain stroke respiration involve alternating pattern of deep breathing and apnea, often seen in neurological conditions or end-of-life care. What is the normal range for an adult's oral body temperature? Options are A. 96 degree Fahrenheit to 97.5 degree Fahrenheit, B. 97.5 degree Fahrenheit to 99.5 degree Fahrenheit, C. 98.6 degree Fahrenheit to 100.4 degree Fahrenheit, D. 100 degree Fahrenheit to 101.5 degree Fahrenheit. The answer is B. 97.5 degree Fahrenheit to 99.5 degree Fahrenheit. The normal body temperature ranges for adult is 97.5 degree Fahrenheit to 99.5 degree Fahrenheit. Variations depending on the time of the day, age, and individual differences. How long should the nurse count the pulse for an irregular rhythm? Options are A. 15 seconds, B. 30 seconds, C. 60 seconds, D. 90 seconds. Answer is C. 60 seconds. For an irregular pulse, a full 60-second count is necessary to accurately assess the heart rate and detect any abnormalities. What is the correct method to measure a child's tympanic membrane? Options are A. Pull the ear down and back, B. Pull the ear up and back, C. Insert the thermometer straight without manipulation, D. Use the opposite ear for an accurate reading. Answer is A. Pull the ear down and back. For children under 3 years, the ear is gently pulled down and back to straighten the ear canal for accurate tympanic temperature measurement. What is the term for difficulty in breathing while lying flat? Options are A. Dyspnea, B. Orthopnea, C. Hyperventilation, D. Apnea. The answer is B. Orthopnea. Orthopnea is difficulty in breathing when lying flat and is often seen in conditions such as heart failure or severe respiratory distress. How should a patient with a suspected spinal cord injury be positioned? Options are A. Supine with a pillow under the head, B. Prone with arms at the sides, C. Flat supine position with head and neck immobilized, D. Semi-Fowler's position. Answer is C. Flat supine position with head and neck immobilized. Keeping the patient flat with head and neck immobilized prevents further damage to the spinal cord until a full assessment can be made. What is the appropriate action if a patient's pulse oximeter reading is 88%? Options are A. Increase oxygen flow without a physician's order, B. Encourage deep breathing exercise, C. Reposition the sensor and reassess, D. Immediately call a rapid response team. Answer is C. Reposition the sensor and reassess. An initial low reading may be due to sensor placement or interference. Repositioning and reassessment should be the first step before further action. Thank you so much for watching till the end. If you like the video, hit the like button, share with your nursing friends, and subscribe the Nursing Exam Insight, the ultimate resource for nursing exams. Once again, thank you so much.